A very good morning to all of you. I'm Dr. Sonam Jindal. I'm going to introduce you the case scenario. Patient Sonia, wife of Kuldeep. She is 28-year-old female, G2P1L1 with 39 plus 2 weeks of gestation. She reported 4 hours ago to the emergency department with fever, cough, breathlessness for last 2 days. She also complained of labor pain and leakage per vaginum for last 6 hours. She had a history of normal vaginal birth 3 years back. She also tested COVID positive, so was shifted to COVID labor room and was provided with triple layer mask. On admission, she was clinically stable and was febrile to touch. Her temperature was 101.2 degree Fahrenheit, blood pressure 126 by 82 mmHg, pulse rate 118 per minute, respiratory rate 22 per minute, SpO2 99%. On auscultation, bilateral chest was clear. On per vaginal examination, C was 6 centimeter dilated, 50% effaced, membranes were absent, and liquor was clear. Pelvis seemed to be adequate in size and shape. She was getting 3 contractions lasting for 20 to 30 seconds. Her CTG trace was normal. Now, our team will be demonstrating how to manage and conduct vaginal delivery in a COVID-19 patient. Through our interaction with the patient, we have tried to highlight the concerns regarding infection control, pain management, breastfeeding, and newborn care. Over to the team.
Thank you, Dr. Sonam. Sister, we will now examine the patient. We have already made our entries in the COVID logbook, and from this point on, we will assume that we are attired in complete PPE gear. So let's examine our patient. Good morning, Mrs. Sonia. How are you? I am Dr. Priyanka Sharma. I am your gynecologist, and this is Sister Preeti, and she is the staff nurse on duty, and we will be taking care during your childbirth. Now, I have reviewed your record, and it tells me that you have had a previous normal delivery. Is that right?
Yes, doctor.
Okay, so you are currently in active labor. Are you feeling comfortable?
Yes, doctor, I am okay. I have cough and fever.
All right. So are you feeling breathless?
No, doctor.
Sister, could you please check the vitals of the patient?
Okay, doctor. Doctor, patient temperature is 100.3 degree Fahrenheit. Pulse rate is 116 beat per minute. Respiratory rate is 22 breath per minute. SpO2 is 99% with room temperature. IV line has been established. Patient is in spontaneous labor. Injection paracetamol was given at 8 a.m.
All right. As per your record, Sonia, your chest is clear and you have what we classify as a mild disease with mild symptoms. And the good news is that it is not likely to interfere with your ability to deliver the baby vaginally. I would now like to examine you, your abdomen, and for that I would like to undress you. Sister, please help me.
Yes,
also, I would like to know what is the last time you emptied your bladder?
Doctor, about 10 minutes ago.
All right, perfect. So let us examine the patient. All right, perfect. So you are you're in active labor. You are getting good contractions. Each contraction is lasting for about 40 to 45 seconds. And you're getting about 3 to 4 contractions per minute. So you are in advanced labor. The baby is approximately 3 kg in weight and the head is engaged, which means the baby has entered the pelvis. Your fetal heart tracing shows that the CTG is normal. The baby is healthy and happy inside your womb. I would now like to do a per vaginal examination to see how far along in labor you are. This is not a painful procedure, but you may feel some discomfort. So if you feel uncomfortable and want me to stop, please let me know.
Okay.
Do you feel any rectal pressure?
Yes, doctor.
All right.
I'm feeling strong urge to push down.
Very good. Okay. So sister, please prepare the patient for a per vaginal examination.
Yes, doctor.
It is important to note that respectful maternity care and the principles of respectful maternity care have to be followed in all conditions, including that during labor in a COVID patient, autonomy, consent, and freedom from abuse are the right of every woman, and these should be respected even during a COVID delivery. Hand hygiene is absolutely essential for all examinations, and the 5 moments of hand hygiene should always be maintained. Sonia, I will now be performing an examination on you.
Okay.
To check how far along in labor you are. Please relax and breathe gently. All right. Perfect. So you are fully dilated, which means you are likely to deliver in a few minutes now. I need to tell you about certain things. Sister, would you please start preparing for delivery? Please also inform the pediatric team.
Good morning, doctor. I am Sister Preeti calling from COVID labor room, 2nd floor. This is an urgent pediatric call for vaginal delivery of patient Sonia. MRT number is ABC XYZ to the COVID labor room. She is G2P1L1 with 39 plus 2 weeks in 2nd stage of labor. She is COVID positive with mild disease. Vitals, SpO2, CTG trace of fetus is normal. Estimated baby weight is 3 kg. Kindly report to COVID labor room immediately for vaginal delivery. Thank you, sir.
It is very important to have effective interpersonal communication during such emergency situations. So it is always good to first identify yourself and follow the SBAR pattern, where you inform the situation, your background, the assessment, and what is requested from your side, just like it has been demonstrated by sister here. Sonia, I would now like to coach you about how you have to take pains. You told me that you are having an urge to push down whenever you're getting contractions. So that is a very good sign. That means you are ready to push and deliver. It is important to know that when you are bearing down, you have to push downwards in short, multiple bursts with your mouth open. Do not draw in one breath and push down. That is ill-advised. So short, multiple pushes to be done whenever there is a contraction. Wonderful. You're doing a very good job. Also, it is very natural for women to pass stools while they are delivering. So if you feel the need to defecate, feel the need to evacuate your bowels, do not worry and please go ahead. We will take care of it.
Doctor, the pain is very unbearable. Can you give me something for the pain?
There are multiple options that can be given for pain relief. The most effective of them is an epidural analgesia. However, you are too far advanced now to be able to cite an epidural line. So currently what is recommended for you is that we can give you some injectable painkillers of the family of NSAID drugs. So are you willing to get an injectable painkiller?
Yes, doctor, please.
Sister, please give injection diclofenac 75 mg, slow IV, start to the patient.
Okay, doctor.
It is very important to ensure that there is good pain relief during labor. This is a part of the WHO's positive intrapartum birth experience.
I'm giving you IV painkiller. Let me know if there is any pain.
Are you comfortable, Sonia?
Yes, doctor.
So I would like to inform you that after labor, you can keep your baby along with you after delivery. It has been found that a healthy baby and a healthy mother should not be separated from each other, even in the COVID situations.
Okay, doctor, thank you.
I also need to tell you that you will be able to breastfeed your baby after delivery, because breastfeeding, even in COVID mothers, is supposed to be very beneficial for the babies.
Okay,
So,
doctor.
sister, are we ready for delivery?
Yes, doctor.
Has the pediatric team arrived?
Yes, doctor.
Could you please do part 2 of this safe birth checklist while I scrub in for the delivery?
Yes, WHO safe childbirth checklist. Antibiotics given to the mother checked. Second, no need to give injection magnesium sulfate or any hypertensive treatment checked. Essential supplies are at bedside and mother prepared for delivery. Check for mother: gloves, alcohol-based hand rub or soap and clean water, oxytocin 10 units in syringe. For baby, clean towel, sterile blade to cut cord, suction device, bag and mask are available. Check. Next, no mother has not needed any birth assistant. Check.
शीट हटा दो, पैड हटा दो. Sheet. Sonia, we will now start with conducting the delivery. We will be performing an antibiotic scrub of your genital area. This is not going to feel uncomfortable or painful, but it may feel slightly cold.
Okay.
All right, so with every contraction, I want you to push down. I want to inform you that the baby has now reached just short of the vaginal opening. It is important that in COVID deliveries, due care is taken for infection prevention. Push, push, keep pushing, short pushes. The head is descending progressively with each contraction. So keep going. I can see that the introitus is loose and lax. I will not be requiring a episiotomy. It is very imperative to ensure that there is minimal leakage of fluids or spill and splash, and also that needle stick injuries are avoided in a COVID patient. Keep, very good. With every contraction, push down. The head has now crowned and she is, could I have a pad please? She is likely to deliver. I will give perineal support to prevent a tear. Push, push, push. Very good. The baby is about to deliver. Push, push, push. Wonderful. Keep going, keep going. You're doing an excellent job. Keep going. Wonderful, wonderful, wonderful. So after the baby is delivered, the baby is kept on the mother's abdomen, baby towels, on the mother's abdomen.
Female baby is delivered at 11 a.m. on 26 January 2022.
A pre-warmed towel is used to wipe the baby, and then a second towel is used to cover the baby. A cap is used to cover the head. The head of the baby is placed in such a manner that it lies between both the breasts so that the baby can suckle after some time. Delayed cord clamping has to be practiced in cases of COVID delivery, as early cord clamping does not reduce the risk of transmission of infection. I will now exclude a second pregnancy by abdominal palpation. Sister, give injection oxytocin 10 units intramuscular stat.
Yes, doctor.
This is a part of the active management of third stage of labor.
Let me know if there is pain. Please don't move.
In the absence of oxytocin injection, tablet misoprostol 600 micrograms per orally can be given.
Injection oxytocin 10 unit intramuscularly given.
Now, delayed cord clamping is to be done, where cutting and clamping of the cord is done either after 1 to 3 minutes or once the pulsation stops. This is followed by delivery of the placenta by controlled contraction. Sonia, I'm now going to deliver your placenta. This is not going to be painful. There may be some discomfort. You will feel some pressure in your genital area. If you feel uncomfortable, dizzy, faint, or if it's very painful, please let me know.
Okay.
So for controlled contraction, it is very essential that the uterus be contracted before a pull is applied. So once the uterus is contracted, it is pushed upwards and backwards, and counter traction is applied downwards on the placenta. Now, if the placenta does not separate, we wait for another 2 to 3 minutes and try again. Always pull only when the uterus is well contracted. So we keep pulling gently downwards to deliver the placenta. If the placenta doesn't deliver, we can wait for as much as 30 minutes before intervening. So, once the placenta is at the introitus, it is held between the hands. Can I have a kidney tray, please? Rotated and delivered to remove the membranes, and it is kept aside for examination. I would require a clean pad. After delivery, the uterus is squeezed from above in order to remove any clots. This is followed by cleaning the perineum and examining for any clots. So if there are any clots, the clots are removed and the perineum is cleaned to inspect for any tears or lacerations in the vagina or the perineal area. So there is no abnormal bleeding. The perineum seems to be intact. I will put a clean sterile pad on the introitus while I examine the placenta. So for examining the placenta, I will first hold the placenta in my straight palms while the palms are facing upwards. I will examine the maternal surface. The maternal surface has around 10 to 15 cotyledons. There should be no clots or missing cotyledons. After this is done, the placenta is turned over and the fetal surface is examined. Now this is usually shiny because fetal membranes are attached to it. After that, the umbilical cord is held in the hand like this, and the placenta is hanged from the umbilical cord like a jellyfish or an inverted umbrella. Hand is placed inside, and then the membranes which are hanging down are examined. If there are any tears or if there is a missing membrane, they are evacuated from the uterus. Manual exploration, digital exploration of the uterus in a normal delivery is otherwise not advised. It is important also to inspect for umbilical artery and umbilical vein. So there should be 2 umbilical arteries and 1 vein. And if there's a single umbilical artery, it is important to inform the pediatrician about the same because it is associated with an increased risk of trisomies and congenital birth defects. Sonia, we have delivered you and your baby. You and your baby are both fine. The baby is okay, and we have had an uneventful normal delivery. Are you feeling comfortable?
Yes, doctor.
All right. So sister is going to clean you up now. I want to tell you some things about care for your baby. It is important to breastfeed your baby whenever the baby shows hunger cues. So that usually that turns to about 10 to 12 times, 10 to 12 feeds per day. So feed whenever the baby is hungry, but you need to take some certain precautions to prevent the spread of COVID-19 to the baby. One, you have to always wear a triple layer surgical mask over your nose and mouth when you are breastfeeding. This mask has to be changed every 8 hours. Also, it is important that you perform very good hand hygiene every time you are breastfeeding your baby, which means you should wash your hands with soap and water for 40 to 60 seconds and air dry them, or use a hand sanitizer which is alcohol based and air dry. You should also wipe your nipple and the area around the nipple whenever you are feeding your baby. Sister will now take your baby for immunization and for birth formalities. Your baby will receive the same immunization schedule as all other babies of COVID negative mothers.
Okay, thank you, doctor.
Your baby will also, I want to tell you about the testing of the baby. Your baby will be tested within 24 to 48 hours for COVID-19. This will usually be done with a nasal swab. And after that, your baby will be tested on day 5. Irrespective of whether the baby is COVID positive or COVID negative, you can breastfeed the baby and room in with your baby. I also want to tell you about certain danger signs that you may experience. Now, we will be checking you, constantly monitoring you. We will be coming for every half hourly to check your bleeding and your vitals, and for the next 2 hours, and then every 2 hours for the next 4 hours. But if at any point of time you feel that you are developing high-grade fever, if you feel you are developing any lower abdominal pain, a severe headache, blurring of the vision, if you're bleeding excessively or passing clots, you can always call the patients. If you feel the doctor, if you feel breathless, if you feel you have a chest pain coming on, please call us immediately. Similarly, if your baby feels limp, if your baby feels blue, if your baby feels pale or yellow, or is refusing feeds, or is not passing urine, or if there is bleeding from the umbilical cord stump, you should immediately call either sister or doctor to help you. Are you comfortable? Do you need any more help?
No, doctor, I'm comfortable now.
Perfect.
Thank you, doctor.
Sister, could you please tell me the vitals of the patient?
Yes, doctor. Patient's temperature is 98.8 degree Fahrenheit. Heart rate is 99 beat per minute. SpO2 is 98%. At the room temperature, BP is 113 by 73 mmHg.
Have you completed part 3 of the WHO safe childbirth checklist?
No, ma'am, I'm just completed now. WHO safe childbirth checklist after the birth. No, mother is not bleeding abnormally, check. Antibiotics are in continuation, check. Magnesium sulfate and antihypertensive treatment was not needed to given. Does baby need any referral? No. Antibiotics? No. Special care and monitoring? No. Exclusive breastfeeding started by mother after skin to skin contact, check. All the danger signs was explained by the doctor.
Thank you so much. That brings us to the end of the scenario. It is very important to recognize like that a COVID mother has to be treated like any other mother from an obstetric point of view. Management of a COVID delivery is similar to non-COVID mothers. It is important to maintain infection prevention. It is important to stress that immunization of the baby, rooming in, and breastfeeding should continue as in normal babies. Thank you.
I have a question to the team. Is it mandatory to do RT-PCR for all parturients who are reporting to labor room?
Currently, the guidelines, the government guidelines currently are to not test women, especially women who are asymptomatic should not be tested when they're coming for labor. However, this guideline has, there are certain controversies and there are questions and objections to this guideline. So in the interim, till a further decision comes, I think it depending upon your resources, if possible, an RT-PCR should be done because it is very imperative to isolate mothers who are positive from mothers who are negative. So where resources are available, it is still advisable that an RT-PCR may be done.
Okay, thank you. How do you triage if you suspect that a parturient is COVID positive?
So for triaging of the woman, when a woman comes to our labor room, what we do is we take a history. This history has certain screening questions. These screening questions would usually be about either contact or they will be about various symptoms like fever, cough, breathlessness, history of travel to COVID endemic areas, which is pretty much the whole country in the current scenario. So if a woman is negative for all this, she is kept in the COVID negative labor room. If there is a suspected history, then she is kept in a COVID suspect area, which is in the labor room, but isolated till her RT-PCR report is available to us. And if she tests RT-PCR positive, she is sent to the COVID isolation ward. So what is important is it is best to divide your labor room or your patients into 3 groups, depending upon whether they are free from COVID, suspected COVID, or whether they are having actual, if they are RT-PCR positive for COVID.
Okay. Thank you, Dr. Priyanka. I have a question which has been asked from many people. What is the advice you give for breastfeeding to COVID positive mothers?
The evidence from the last 2 years has shown us that there is no conclusive evidence for any transmission of COVID infections through breast milk. Whatever transmission can occur through contact. However, the risk of that transmission is also low. It is in the range of 2 to 4%. So 2 to 4% of neonates of COVID positive mothers may get infected, but infection in neonates is usually mild. When we compare this to the benefits of breastfeeding, it is felt that breastfeeding is extremely beneficial in the short and long term. So current government guidelines and current institutional policy in our institute is to promote breastfeeding like in normal mothers with due precautions like wearing a triple layer surgical mask by doing proper hand hygiene.
Thank you, ma'am. There is one more question from Dr. Kapil Dhillon. If parturient is COVID positive, then what are the steps of important points to be remembered during the delivery in the aspect of mother and baby's safety?
So delivery is conducted, a cesarean needs to be done only for obstetric, the cesarean needs to be done only for any obstetric indications. There is no need to do a cesarean just because the mother is COVID positive unless an immediate delivery is required to improve a worsening mother's condition. A COVID delivery, by and large, is same to a non-COVID delivery, except for the fact that we have to maintain a strict record of whoever is entering the labor room so that potential contacts can be traced. Infection prevention measures have to be kept in control. Use of PPE has to be stressed upon. The patient has to wear a triple layer mask at all points of time. We need to prevent infection spread. There is no contraindication to an artificial rupture of membranes, but any spill or splash should be avoided. So the steps of delivery can continue as normal. Essential newborn care is the same. Breastfeeding is always, and rooming in has to be promoted.
All right, thank you, ma'am. There is one more question from Dr. Vedavati Nayak. The question is, in a pregnant woman who is in the late second or early third trimester with moderate to severe COVID, what is the recommendation for delivery?
So again, it is a very case-based decision that has to be taken. For a moderate disease, if the patient is stable, we can delay delivery, we can wait for improvement in the condition. But if the condition is worsening, we need to terminate pregnancy. Now, it has to be a very case-based decision that has to be taken.
There's one more question, ma'am. Question from Supraja Nagaya. How do we manage moderate rate and severely affected COVID patients?
I think I addressed this question previously. The one question that could be asked for would be the status of antivirals, probably. So standard care is the same. We are giving steroids to our patients. We are giving broad spectrum antibiotics to prevent secondary infections. The role of remdesivir, it has been given permission, but it has been very mixed. The response has been mixed. Apart from that, I think whatever standard care is given, and I have answered the question in the previous question.
All right. There is one more question, ma'am. What are the guidelines for current guidelines for COVID vaccination?
In pregnant women?
Yes.
Very good. That's a very good question. There are a lot of questions that come up. So COVID vaccination world over now, and especially in India, Covishield, Covaxin, both of them are recommended in any trimester of pregnancy. You do not need to abort if you have conceived on a COVID vaccine. There is no association as of now of any congenital birth defects or adverse obstetric outcomes for women who have got the COVID vaccine during pregnancy, either on purpose or intentionally or accidentally. The other important thing is that if you develop COVID infection during pregnancy, it is important that you get the vaccination as soon as you deliver.
All right. Thank you so much, ma'am. There's one more question. I think you have already answered. So I advise the audience and viewers to go through the recordings on the Facebook, and we will share, if you have registered, we will share these recording to you on your email. And the question from Pratibha Shekhawat, should the team conducting normal delivery or COVID negative or COVID positive be different, or can you conduct delivery of any patient?
I believe our institutional policy is to use the same people. Depending upon your resources, you could arrange for a different team. But we have been, I think if COVID deliveries are conducted with due precaution, the infection from the healthcare team to non-COVID patients become almost negligible. So the same teams with due precaution can deliver a COVID positive and a COVID negative patient. I think most institutes are following the same protocol as of now. I thank you so much. It was very invigorating to know that there were so many questions from the audience, and I thank the organizers for this opportunity.
Thank you, ma'am.
So I would just like to, we'd like to take a bow and introduce our team. This is Dr. Sonal. She's an assistant professor. And we have with us Sister Preeti. She's staff nurse in the labor room. And Sister Anju with us. She's nursing in charge. So thank you very much.